I'm Dr. Mia. Welcome back to the STEMspired podcast, the show where rising voices in STEM share their journeys, their wins, and the wisdom they've picked up along the way. For today, we have a special guest, Dr. Halle Tukes, and she is a powerhouse who recently earned her Doctor of Pharmacy degree. She's already making waves as a thought leader and mentor, but her path wasn't always linear. So today, she'll open up about what drew her into healthcare and how her identity as a Black woman has shaped her journey as she has pushed past things in pharmacy school. So, if you've ever questioned your place in STEM or wondered how to stay rooted in purpose while pursuing excellence, this conversation is just for you. And thank you so much, Halle, for agreeing to be on the podcast.
No, you're welcome.
So I know we're very familiar with each other, but our viewers don't know you. So can you give a brief introduction of yourself?
Yes. Well, my name is Halle Tukes, and I'm from Quitman, Georgia. Um, I attended Fort Valley State University, where I obtained my bachelor's in animal science. After graduating from there, I went to the University of Georgia College of Pharmacy, where I just graduated May 3rd, 2025. I'm currently a PGY1 resident through the University of Florida College of Pharmacy, and I'm the youngest of five kids.
And out here doing your big one. So y'all, we're from small towns in Georgia. So the fact that we made it out of, places where there weren't many resources, and look at us now. I'm telling
Mhm.
you. So, what inspired you to pursue a doctor of pharmacy degree, and how did your interest in healthcare evolve over time?
Okay. I will say initially, at least upon graduation from high school, I wanted to be an orthodontist. I had braces for about 5 years. So going into the office, I was like, oh yeah, I'm going to dental school. So that's really why I went to Fort Valley State. Fort Valley State is known for graduating African Americans from the school and then later going to dental school to become a dentist. Um, I would say probably around my third year undergrad, I started working. Well, I was already working at Harvey's, which is a small um, grocery store that was in Quitman. It's now called Food Line. But I was a cashier in the pharmacy. And, looking at the pharmacist, I was like, oh, that's all they do. I'm like, I think I might like this. And also seeing how the pharmacists served the patients whenever they had any questions and educated them on medications that they were being prescribed. I started working at an independent pharmacy that was in our hometown and is still there. And seeing how my mentor there interacted with the patients, seeing how he sponsored different softball teams or boys and girls clubs, whatever it was, he was a sponsor. People knew they could come to him, whether it was about life
Hmm.
situations or about medications. I was like, okay, I think I wouldn't mind being that person that my family could rely on, or either close friends too could rely on when they needed advice on medications, or hey, my child is sick, what can I give them without, you know, it being harmful. And I just feel like Brooks County has a pathway, and I
Hmm.
realized not all schools do that. So going into high school, I went into the healthcare pathway. So I knew I was going to always do something in healthcare. I just didn't know what. I knew I wanted to stay away from blood and throw up. So as as I went
Can't
along,
blame you.
that's why dental school also did not work out, because I'm like, you have to pull teeth. Like I had to be realistic with myself. Yes, I give shots, but the blood that you might endure on that is not as bad as pulling teeth. So I think it's just I was open-minded to learn as much as I could throughout high school, throughout shadowing dentists, and then also by working in the pharmacy.
And that's amazing because a lot of times, at least at the high school level, it's very hard to know what resources are out there. So the fact that you utilize like a high school job to kind of figure out your way and learn about different pathways in healthcare, I think is a very good thing to share with students, because at least when you come from smaller towns, like you really don't know how to go about it necessarily. So using those resources provided through mentorship programs or whatever, especially at HBCUs, love a good HBCU. They help get us ready. I feel like they
Yeah,
prepared us for the rigor.
yeah.
So that leads me to my next question. How did mentorship or community help support um, your success during pharmacy school and your educational journey?
Well, coming from a small town, I feel like also my mom is or was an educator at the time. She was a principal. I feel like a lot of people were in tune in my journey. So a lot of people were asking her, "Hey, how's Hallie doing in school?" And I think that's something that I didn't realize helped me to keep going throughout school. Also, when you learn that there are a lot of young ones, like I got two godsons now. When you know there's people relying on you to be successful so that you can show them too that they can be successful, I think that's when I
Mm,
realized my community does support me. Um, Also having my mentor who owns his own pharmacy and was willing to lend out the helping hand to get me into school and also help me make a decision on where I wanted to go to college of pharmacy. I think he played a big role because, like I said, how he impacts the community, I want to be similar.
yes, we love to see it. We need more Black pharmacists that's out here paving the way. And especially right now, our students, especially Black students, need to see that we can still do this, even though more barriers are being put in place to make sure we
Mhm.
don't, but we
Right,
will overcome them, especially as our ancestors did.
right.
So, what was the biggest misconception you had about pharmacy school before starting? So, I know you had many experiences before that.
I feel like the biggest misconception I probably had of going to pharmacy school was I felt, for some reason, at least, I felt like people would be as open as an HBCU is. So
Mm, mm-hmm,
once I entered into pharmacy school, I realized, oh, I couldn't be as loud, right, without being looked at a certain way, um,
mm-hmm.
or I had to carry myself a certain way. So that was something like it was a wake up call. I had to be like, okay, Hallie, get right. People watching you. You don't want to be that outcast. Do what you have to do. So that was something I
Yeah,
realized probably within the first week of being.
yeah. It's a huge culture shock, especially for those who went to HBCU and then you're submerging yourself at a medical research institution where there's hardly anybody that looks like us there. So
Mhm,
it can be very challenging. So I like the fact that you said that you opened up and were vulnerable about that, because a lot of people sometimes, I would say, feel ashamed about it, but it's not an experience that is foreign to us.
mhm.
So good thing you shared that. And that leads me to my next question. So we're Black women in STEM, of course. So how specifically do you think your identity has shaped your experience in grad school and as a professional now in the field?
One of the things that I feel like I've learned the most while going through grad school and growing professionally is that you do not have to change who you are. You just
Mm-hmm.
have to adapt to the crowd that you're around. So I feel like I'm still the same Hallie from HBCU. Like when I go back
Mm-hmm.
homecoming, that's what you're gonna get. But
Period.
when I'm around, when I'm at a conference, oh, you're gonna, hello, my name is Hallie. How are you? I just feel like learning to adapt without
Mm-hmm.
changing who you are. Not everybody
That's a good one.
understands that. Like some people might be like, "Oh, she's acting funny," but it's like I say, learning how to adapt to the people you're around. I think that's the best thing that you can do. If you can adapt, whether you're around a whole bunch of nerds, whole bunch of black people, bunch of white people, that's a great trait to have.
And I liked how you said we're adapting and still being ourselves, not conforming. There's a difference. That's a different thing. So it's very important, especially with our identities, to be able to stand and take up space and be authentically ourselves, but of course adapting. So the way we would deliver that message somewhere else may not be
Mhm.
the best way to deliver it in that space. So
Mhm.
I totally resonate with that. And so now that you've crossed the finish line, you've earned your PharmD, whoop whoop. What are your current professional goals now?
Currently, my professional goals um, are completing this residency. This residency allows me to get some more experience in independent pharmacy, owning an own pharmacy, and
Mhm.
also opening the door for maybe being a teacher on down the line or a professor. I never thought I would be interested in academia, knowing my mom was a teacher. I'm like, oh, I would never do that.
Me
But
too.
pharmacists as professors make good money still. So CMC though is something that I've learned that I might like to do. I will hold study sessions quite often, and my classmates started saying, "Halle, you should be a teacher." And I started thinking about it. I'm like, you know what? I think I wouldn't mind, being a mentor to others and showing them the way while also being able to educate them. So whether I'm owning another pharmacy or being a professor on down the line, I am still open to trying to learn as much as I can so that I can be, the best pharmacist that I would like to be while also touching as many lives as I can.
Absolutely. And hey, you can do both.
Yeah, you're right.
You
Someone
can do
said that
both.
too. You
Yeah.
can.
Yeah. I mean, I totally feel you. I've said the same thing. I'm like, I'll never teach. And now look at me. Now,
Yeah, no,
now
it
I'm
be like that.
now I'm teaching, but I guess like it's we've watched all our lives the impact of education and mentorship, what it has on people's trajectory. So yes, we definitely need people in there, especially in the academic space. And I'm like you. I said, I ain't about to fool with academia,
Yeah.
but we can fool with it in our own way by not
Mhm.
completely submerging ourselves in it, but we still have our own thing. So sky's the limit for us now that we have doctorate degrees.
Right.
So how do you see the future of pharmacy evolving? And I know you said you want to go into mentorship and all these different aspects. So where do you see yourself making the biggest impact?
One, I feel like pharmacy as a profession is overlooked. Yes, you see pharmacists, you think, oh, Walmart, CVS, Walgreens. That's not all there is to pharmacy. You could go sell drugs, you could go work and do research, you can
Mm-hmm.
go work for insurance companies. You don't have to talk to a single patient. You could be on the business side of things and never speak to a patient, but you're a pharmacist. Um, so that's just something I see pharmacy continuing to grow in the industry side.
Mm-hmm.
Because like I said, going into pharmacy school, I only knew, oh, Walmart, CVS, but it's way more to pharmacy than I mean, I even could imagine. Um, and as far as for me, I feel like me, how I want to make the biggest impact is honestly and truly just being that person in my community. Like I could care less about anything else. I just like wherever I decide to settle down in the future, I genuinely want that to be my hometown. I want to be involved. I want people.
Mm-hmm.
Yes, Hallie's a pharmacist, but she cares about the people in the community. So, um, since I've graduated, I've always went back and spoke to my high school just because I feel like it's important to understand. Like, yes, we're from Brooks County, but you can do what you said you're gonna do. You just gotta push yourself to do it. So, just to be that mentor to those who might not have it at home.
And that's so valid. We need mentors. And I like the fact that you said wherever you settle down, you want to just put yourself out there. And like you said, I even learned about what people can do at PharmDs. I mean, even the med tech industry, biotech industry, they want
Mhm.
PharmDs bad. I'm like,
No, for real. Like when it
and they
comes to
get paid
certain
well.
things, people prefer a pharmacist for real. So it's a lot to pharmacy that, like I said, I had no idea about. No idea.
Yeah, yeah. I mean, I didn't even know about the insurance thing. I'm like, oh,
Mhm.
I learned something new.
Mhm.
So, as your experience, what advice would you give people who are first gen doctors or underrepresented students who are entering healthcare fields or, STEM related fields?
I would say that it's going to be hard. I'm not going to sit here and say it's easy. But the main thing I would say is find your why, whether that's your mom, your family, your kids, your
Mm-hmm.
husband, your wife. I think it's important to find your why. So on those days you feel like giving up, think about your why. Like my wife, a lot of
Absolutely.
times my mom, like she didn't push me to do anything, but I all I had to do was call her, look at her, and I'm like, that's why I'm doing it right there. Or look at my godsons, just think of the reasons you cannot fail. I wanted to succeed. I wanted to be, once I'm the first in my family. I think that is something to be, grateful for, but it's also like I'm showing
Mm-hmm.
everyone else below me or older than me that you can still go do that too. Like, don't limit yourself. Push yourself because you just can never, like, you won't know what you can accomplish if you don't try.
Mm, that's a big one right there. And it's never too late.
It's never too late.
We can always strive to reach
Yes,
our goals wherever, at whatever state or whatever age we are, whatever we want to do, as long as we put our mind to it, we can do it.
yes.
Okay, so how can our scholars connect with you? You got socials,
Mhm.
LinkedIn, what's going on?
I have LinkedIn. It's under my name. I also have Instagram where you can reach me at underscore Halle.Tukes. And then I also have Facebook. I use all of those faithfully. So if anyone ever wanted to get in contact with me, that can be something that can happen. Also, I can give you my email, uh, which would be Halle.Tukes at ufl.edu. And anyone can reach out to me, and I'm willing to help them along their journey.
Well, thank you so much for sharing all of these valuable things. I think so many people can benefit from the things you have to say. Y'all check out Halle. She's doing her thing out here, y'all. So that's a wrap on today's episode with the incredible Dr. Halle Tukes. Her story is a powerful reminder that there's no one way to succeed in STEM, and that being true to yourself is not just allowed, it's essential. And if something Hallie shared resonated with you today, please pass this episode along to a friend, a student, or anyone who could use a little fuel for their own journey. Don't forget to follow the STEMspired podcast and connect with us online for more voices that inspire. Until next time, keep leading with purpose, keep learning with heart, and stay inspired.